Well, good morning, everybody. This is Mark Idleman, speech-language pathologist, and welcome to the teaching of talking, and welcome to this class that helps everybody learn about aphasia. People learn about apraxia. People learn about swallowing difficulties. And these are all very, very, very important subjects. And you know something? What I'm finding out from the listeners and the people who are watching these, that much of this information is not understood and is not shared often at a hospital level. And so many people, many caregivers are really kind of in the dark about many of the most important aspects of how to help someone talk or what to do when an individual has difficulty swallowing. So what I'm going to do, hey, Malka, hey, Carol, and gosh, it's great to see everybody. Hey, Diana, and hi, Jean, and hi, Natasha, and hi, Diana. And I'm glad to see my friend Joe, who's on board this morning. So this is Mark Idleman, speech-language pathologist. I've been a speech pathologist for going on 46 years. Can you believe that? And I'm here to share with you wonderful information this morning about swallowing difficulties. Now, not everybody with aphasia has swallowing difficulties, but there's still a number who do. And there are some things that a speech pathologist knows that many people, a caregiver, a loved one, that they don't know. And so I'm here to share with you what I know about swallowing difficulties, because I worked in rehabilitation hospitals, and I used to get up at 5 a.m, get to the hospital at 6, and be with patients when they'd have their breakfast. And there were a number of them who had serious swallowing difficulties. So we're going to cover swallowing difficulties, and then we're going to cover speaking difficulties. And I like to teach by example. And so on the call, in the second half of the call, I'll be calling on you. I'll be calling on you to tell me about how you're progressing on the path of better speaking. Because this is a great subject, and there's so much more out there to help people who've got swallowing difficulties or speaking difficulties that many people just don't know about. And I'm here to help you learn these things so that you can apply them if you happen to live somewhere far away from a speech pathologist, or you've been terminated from therapy or whatever. That's what this whole thing is about. So let's do this. Okay, I want everybody to take your right hand and put it around your neck and feel your Adam's apple, okay? And then what I want you to do is I want you to swallow. Well, do it one more time. Well, if you noticed, your Adam's apple kind of went up and then it came down. And that's what it's supposed to do. Now, when a normal person swallows, the larynx, or the voice box, goes up, and then the vocal cords come together like this. So they form a seal. So that when you swallow, nothing goes down the airway. Okay? The vocal cords act like a trap door. They close, and they prevent liquids. They prevent foreign bodies from going into the airway. So that's kind of cool. While we're breathing right now, our vocal cords are open. They're open. And they're open, and they're letting us breathe, and the vocal cords are just sitting there like this, and we're breathing away, thank goodness. Okay, so the vocal cords are open. And now when we go to talk, the vocal cords vibrate like this. And later this week, we're going to have a special Facebook Live on voice difficulties. But that's not where we are right now. We're on swallowing difficulties. So the thing to keep in mind, everybody, is that when you're breathing, the vocal cords are open. Thank goodness. Now, when you're talking, the vocal cords are vibrating. Now, when you're swallowing, the vocal cords form a seal. They form a seal. They lock together. Then when you go swallow a pizza or a hamburger or some fish and chips, these vocal cords, they close together, and they close together over the airway that go down into the lungs. And you want those suckers to be closed when you're swallowing. You don't want anything to get into the airway. Now, I don't know about some of you. Every once in a while, I'll have a Diet Coke or something like that, and I'll take a sip, and it'll be the first sip of that Diet Coke, and there's a whole lot of carbonation. And guess what? I'll penetrate. I'll do something called penetration. Penetration is when just a little bit of liquid starts going into the airway. And that's when you kind of cough, and that's when you kind of choke. And I know everybody on this call has had the experience of coughing or choking on something. Now we talk about a person with aphasia, or a person who's had a stroke, or a person who's had a head injury. You've learned, and many people have been on the call, so it's great to see you, like Joe and Diana and Natasha and Malka. You know, all of you have been learning about aphasia and motor speech problems, okay? Usually motor speech difficulties go hand in hand with aphasia. Not always, but we've learned about the apraxias. The apraxias are when the motor in the mouth that operates the tongue and the lips and the tongue and the throat, it doesn't work so well. So what happens is that when a person starts to speak, speech is kind of slurred. And if a person has apraxia, sometimes there'll be a droop here at one corner of the mouth, either the right or the left. And not only that, sometimes they'll be drooling out of that side. Now, so if you've got a weakness, a motor weakness, and many of you know this because you've been in the class, if you have a motor weakness in the mouth, guess what? Not only does it affect your speaking and the clarity of your speaking, but it may also affect the swallowing mechanism. Hey, the swallowing mechanism is right next door. In fact, it's at the base of the tongue. So, this is a very, 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 very important question. So, if the vocal cords don't completely come together over the airway, then you're going to get what they call leakage. And leakage occurs when a foreign body, like liquid from a Coca-Cola or a cup of coffee or water or whatever it is you're drinking, kind of leaks a little bit into the airway, and then you'll start clearing your throat. Now, this is a sign, and I'm going to share with you some of the signs that a person may have if they have a swallowing difficulty. And I would say, you know, when I was working in the hospitals, I would say that probably about 3 out of 10, maybe 4 out of 10 had accompanying swallowing difficulties. So that's how it works. If there's a weakness on one side of the body, on the left side or the right side, not only will it affect the arm, not only will it affect the hand, not only will it affect the leg, not only will it affect the foot, not only will it affect the toes, not only will it affect the lip sometimes, or the facial muscles on the side, but it will also affect the vocal cords. So if you've got a weakness on one side, sometimes one of those vocal cords, it may not work so well. And it may not be able to close over the airway. And if it doesn't close over the airway, you're going to have coughing, you're going to have sneezing, you're going to have clearing the throat when a person eats, and quite often throughout the day, even when they go to swallow their own saliva. Okay, so this is something that falls under the jurisdiction of the speech pathologist. Now, you don't want just any speech pathologist. It's just like in aphasia. You don't want just any speech pathologist, or you don't want just any speech therapist. You want a specialist who knows about swallowing, who's focused their work and a good part of their experience on swallowing difficulties. Because you could have a speech therapist or a speech pathologist who might work in the school or might, work in some other kind of setting who doesn't get people. Sometimes they don't get people with swallowing difficulties. So then sometimes you call upon them to help you with a swallowing difficulty. Well, quite often many of them may not be up to date and may not have been practicing like people who are specialists are. I'll never forget, I started out probably about my second or third year in practice, and that was like 42 years ago, and I was called to consult in a nursing home. And so I decided I'd go over there at about 7:30 in the morning to see a patient. They asked me to come and evaluate a patient who had a stroke. And so I went over there, and I walked into the room, and there was a CNA that was trying to force feed a patient breakfast. And so I came in there, and she was saying, "Now, Mrs. Jones, you haven't been eating. Come on, we got to eat, because they're going to be, the nurses are tracking everything that you eat, and you're not eating enough, and we're really, really worried about you. So I'm going to help you eat." All right. So she had one arm around the patient's, and around the back of the neck, and she was just shoveling that food into the patient's mouth. And it looked like the patient was almost drowning when the CNA was feeding this person. And then all of a sudden, about a minute later, the patient vomits all of this stuff all over the place. Well, I came back a couple of days later, and the patient was sent to the hospital and had something that we call aspiration pneumonia. And aspiration pneumonia occurs when a foreign body gets into the lungs, gets infected, and then creates something like a pneumonia. So there are patients, too, out there, those with aphasia, those who've had a stroke, who may get recurrent pneumonia. That means they might get pneumonia more than once. And sometimes aspiration pneumonia from food possibly getting into the airway may be a culprit. So if you have any questions whatsoever about your loved one, or even about yourself, if you have periodic choking episodes or coughing episodes when you drink or when you eat something, that's something to be very, very concerned about. If you do, you want to check probably with your doctor and tell him or her about the problem that you're having swallowing, and that you would like to have your loved one evaluated at the hospital for dysphagia, they call it. That's some name, isn't it? Dysphagia. And usually the best person to evaluate a person with a swallowing difficulty is a speech pathologist who may be in a hospital or a rehab environment where they see a lot of people with swallowing difficulties, and they have various tests like a motion picture X-ray, which can actually, the therapist gives the patient with a suspected swallowing problem different kinds of foods, and they watch the food go down, and they can see if there's aspiration. And that's really a great test. And then they can find out if solid foods or soft foods are any safer. They can usually tell if there's any food that's safe to eat or any beverage that's safe to drink. Because sometimes, for years we had to thicken liquids. We had to put this thickener in liquids, and patients had to drink their coffee with this thickener in it. Man, it was the weirdest, terrible. I mean, it was not a good, it was not pretty. I mean, would you like me to come along and put like a whole lot of thickener in your coffee? Can you imagine that? But for some people, it helps them swallow better, and it helps them swallow more safely. But it's not really the greatest stuff in the world, but there are many, many things that can be done for people who've got swallowing difficulties. So what you want to do, if you suspect that a loved one has a swallowing difficulty, you want to make sure that they get what we call a bedside or a desk side swallowing assessment, where they look at how the person swallows liquids, how the person swallows different kinds of textured foods. So we want to look at that, and we want to see what happens. So some of the symptoms that I want to review with you real quick, and these are great. These are great symptoms. Once you're a speech pathologist and you see a whole lot of patients every day, like I have, you can spot it usually, from 100 yards. So here's some of the symptoms. Number 1, frequent throat clearing. That's because there's liquid or there's food that's trying to get in the airway. So a person has to clear their throat or cough to try to clear that away from the airway. The second thing is that they choke or they cough on liquids when they drink. The next thing that you want to be mindful of is you want to listen to see if there's a productive cough. So when they cough, is it a wet cough? Is it a productive cough? Because quite often people who are aspirating or penetrating may have a lot of moisture or different or mucus or different kinds of secretions in the lungs, and you can hear that rattling around. Now, another thing that you want to be very careful of, and this is for everybody, if a person has a swallowing difficulty, and please make sure that you know this, that a person should always be sitting at 90 degrees when you eat or drink something. 90 degrees is when the back is straight up, like I'm sitting in this chair. Like I'm sitting in this car. My back is straight up and down, and my lower body is out this way. So 90-degree angle should be the angle where you eat or drink. Now, I know that some of you might occasionally take a bottle of water or something like that to bed with you and put it on the bedside table. And then when you're sleeping, you might get thirsty. So you might get up on one of your hands or one of your arms and kind of drink like this. Well, if you're a real good swallower, you could probably do it without causing any problem. But if you're a person who had a stroke or if you're a person who's got a weakness in the motor of speech, any position other than a 90-degree angle can be a problem. I remember walking into patients' rooms, and they'd be sitting way back in the bed. They'd be they'd be way down like this, you see, and they'd be, taking a fork and putting it in something and trying to swallow it, and extremely dangerous. So remember, 90 degrees. So what are the symptoms of a swallowing problem? Frequent throat clearing, coughing or choking when drinking liquids. And here's another one. Sometimes a nose will start running after you eat. That's another symptom. I was walking in patients' rooms. They'd be eating, and you can see their nose was dripping. Now, that's one of the signs of possible penetration or aspiration. It doesn't happen in all cases, but it's a warning sign that goes alert, 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 safety, 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 be safe. We got to pay attention here. So when you see any of these symptoms, the coughing or the choking or the nose running or the eyes which water when you're eating, okay, you got to go alert, 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 alert. Be careful, be careful, be careful, be careful. We want to keep this loved one safe, 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 because swallowing has a profound effect on health if you're not swallowing right. If you're not swallowing right, you could be open to infection. You can be open to pneumonia. So this is something you really want to pay attention to. And hopefully not many of you on the call have this problem, but I'm sure that one or two of you may have some concern about this. Okay, so we have a productive cough. We have watery eyes. We have a diminished appetite. So you know what happens if you were to cough a lot during a meal or drinking water? What's going to happen? Well, you're not going to want to eat anything. So if you get choked up when you drink, there's going to be this little thing in your head which goes danger, 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 and you're not going to want to drink all that much. In fact, you might not even want to drink at all because every time you do, you choke on it. And if that happens, you get the dehydration, what we call dehydration. And that's very dangerous. If you don't get enough liquids into your body gets dehydrated. And then you start looking bad. And then your skin color starts looking bad. The same thing goes with eating. If you have discomfort, all of us, let's face it, anything that's discomforting to us, we want to avoid. Whether it be the bills or whether it be, whatever it is, anything that is uncomfortable for us, we want to avoid. And so one of the things and one of the symptoms and one of the findings of people who have a stroke or who have aphasia or have a head injury is diminished appetite. And quite often it's related to the fact that eating is uncomfortable. Eating is painful. Eating can be non-enjoyable. If you coughed and choked every time you took a bite of food, would you want to sit down and have a steak with me? No. We want to avoid what's painful, what's discomforting. And when I walked into that room, being a brand new speech pathologist almost, and watching this CNA try to feed this woman, force feed her, a person can die from something like that. And that's why it's important. That's why it's important to know about swallowing difficulties. This is why I'm spending the time with you, just a short amount of time with you, just to get you up to speed on this so that you'll have the knowledge. Because let's face it, the general public doesn't really have a whole lot of knowledge about strokes. I mean, they never heard of strokes in their life unless their parents had a problem. And then they're faced with something like this, and they don't know which end is up. So it's a learning problem for every caregiver. Okay, so watery eyes, decreased appetite, no desire or diminished desire to drink. Dehydration is common. Discomfort from the choking episodes. Sometimes a voice can be watery. A voice can be gurgly. That's because when they go to swallow, the liquid, the secretions aren't going down. So they form and they pool in the back of the throat. So they go to talk, and what you hear, it almost sounds like somebody's trying to gargle and talk at the same time. And that's another symptom. Watery voice, or a hoarse voice, or a breathy voice. If you have a hoarse voice or a breathy voice, guess what? Those vocal cords aren't coming together. Those vocal cords are not sealing real well. And that's why the voice could be breathy. Because the vocal cords are not approximating. They're not adducting. They're not coming together. Yeah. Okay. So, we can find a food that a person can swallow that will be safe for them. Sometimes we modify the texture of the food. Sometimes we modify the thickness of the liquid. And sometimes we even modify the way a person holds their head or the way they turn it. I had one patient one time, the only way they could swallow safely is if I had them turn their head all the way to the left, which helped adduct, which helped close off the airway. But for a person who's got aphasia, who's got diminished cognition sometimes, man, it's hard to remember to do that stuff. And then it's hard to train the staff in a hospital or a rehab center to make sure that they follow the precautions. Because there are precautions. And there are a lot of mistakes that can occur in a hospital. There are lots of mistakes that can occur even in a rehab center when everybody doesn't know that the person has a swallowing problem. So they say, oh, so the physical therapists, they're doing physical therapy. Oh, you look like you could drink. Let me get you a drink of water. And sometimes the physical therapist doesn't even know that the person has a swallowing difficulty. Well, they're getting better about that today. They're putting wristbands sometimes that's supposed to indicate that they have a swallowing problem or something that they wear. But, most of the time and often, people don't really notice those things. So anyway, that's about swallowing problems. So I want you to remember the symptoms, and I want you to remember the risks of not dealing with a potential problem. Remember, coughing, watery eyes, throat clearing, choking, numerous throat clearing, diminished appetite, dehydration, productive cough. All right. So that's the deal, Lucille. And here's another thing. When the person goes to sleep, if there's a person who's got a swallowing problem, they should be sleeping at a 45-degree angle. Now remember that we want 90 degrees when they eat. And when they sleep, about 45 degrees. Now, why is that? Well, if you sleep normally and you sleep on your back, all those secretions can roll back to the back of your tongue, and you could go to swallow those secretions, and guess what? You're choking. So usually it's much easier and much safer in a 45-degree angle for people to sleep. But some people say, well, I've never slept in a 45-degree angle. Well, sorry about that. You can get used to that very quickly. So anyway, that's a little bit about dysphagia. I hope that it's been something that's been educational for you, and that I hope that you can keep these points in mind. They're very, 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 very important. So now I'm going to take some calls. Let me take a little drink to wet my whistle first, and then we'll share and answer any of your questions about speaking or about swallowing. Now that's the way you should swallow, like that. Not like this. Not like that, okay? Okay. You got to have fun at this. People say to me, they say two things to me. How come you're always laughing? And I say, I like to crack jokes. I like to have a good time. If I ain't having a good time, I don't want to do it. So that's why I'm still doing it. That's why I still love doing it, because I have a good time. I like to have a good time. I like people. I like joking with them. I like getting to know them. And that's the kind of therapist you want. You want somebody who's personable, who's humorous, who you like to see. Yeah. So anyway, the second thing people are always saying is, what's the matter, Mark? You live in your car? Every time I see you, just about, you're in your car. Don't you have a home? Well, I've shared that with people on the call many times. We travel all over the United States and the world, for that matter. We have a 33-foot motorhome, and we lecture all through the country. In fact, we're leaving in just about an hour or two, and we're heading for Pennsylvania, Ohio, St. Louis, Missouri, Denver, Colorado, down to Santa Fe, New Mexico. So we're heading out today, and when you see me tomorrow, you'll probably see me from the motorhome. It'll be inside the motorhome at my desk there, which is a lot nicer than the car. So anyway, let's take some calls. And guest requests, we have Helen and Lynn and Joe and boy, we've got a lot of guest requests here. Wow. Okay, let me first take some people who have not been on the call yet. And so I'm going to look here. And I don't want to invite friends to watch. I want to... I don't want to tag them either. I want to, when they appear, allow your viewers to request to join you as a guest. Yes, that's what we want. I'm going to invite Wendy Simpson. And let's see what Wendy has to say. We're going to bring Simpson on. You want to make sure that your camera is horizontal, and you want to make sure that your camera is on so that we can speak with you and we can share with you and we can help you, maybe give you a couple of suggestions about your speaking, or maybe we can answer some questions about swallowing. So we're waiting for Wendy Simpson. We'll wait about another 15 seconds or so. You know, this Facebook Live, it still has a couple of glitches in it. And so I'm sure it'll get better in time. It's brand new, and I think it's a great platform for teaching. So I'm going to wait maybe about 5 more seconds, and if Wendy doesn't come on, we're gonna kind of move on to the next person. No, wait a minute, is she coming on? No, it says no answer. Okay, so let's see who else we guest request. Let's see. How about Sheila Thomas Milner? Sheila Thomas Milner. Sheila. Let's hope she comes on. I usually find that we get about half the people who want to be on the call, we usually come on. The other half, sometimes they're either they don't have enough bandwidth, or their camera isn't turned on, or something like that. But let's hope that Sheila Milner can come on. I'm very familiar with the Milner name. I remember Malka and I were riding in the motorhome one time, and I was getting real tired, so I pulled over for lunch, and we stopped in this rest area. I laid down on the couch, and then somebody texted me, and it was a woman whose husband just had a stroke. Well, I'm going to wait about another, no answer from her either. Oh, that's disappointing. Okay, so we're going to go to the next person. And we're going to go with Latoria. Well, let's bring on, she's a blast out of the past. Latoria Pinckney. Oh, my goodness gracious. She's a person who worked at one of the hospitals with me a number of years ago. A wonderful person, very upbeat, and so I'm gonna bring her on the call, but she declined. Oh man. Okay, well, I send my love to Latoria. Let's try. How about Jenna? Let's see if we can find Jenna. So let's see, Jenna Rusi. Let's try Jenna. Now remember, you want to have your camera on. You want to be horizontal. And we're going to bring Jenna on. And hopefully we can, it says they're adding her. I just hope so. Because sometimes this Facebook Live gets a little glitchy, but it has a picture of her in there, and it says that we're adding her. So just make sure your camera's in horizontal, and we'll address any question that you have, and maybe we'll give you a pointer to who knows what we're going to do. But we're waiting, and we're waiting, and we're waiting. And I'm going to wait maybe about another 10 seconds or so. And hopefully she'll come on here. I haven't seen it yet, though. So let's see. Swipe left. Okay, I'm swiping. Okay. Swipe left. Quiet mode. Turn. We don't want quiet. Okay. Okay. There we are. Okay. All right. So let's try somebody else. I'm going to try somebody I know. How about Donna? Let's see, Donna. Donna Prima Donna. Donna. Let's see, Donna. Come on, Donna. I want you to make it this time. I'll try about 2 or 3 more. I don't know what this. Maybe I think this will work for Donna. Let's hope it does. It says that we're adding her, and thank you for coming on. Now it says no answer from her. Well, let's try. I'm going to approve it. Maybe I needed to approve it. You know, this is still new to me, so I hope everybody can be patient with us as we learn this whole new Facebook Live platform. It's just like learning anything, and many of you are going to be learning the teaching of talking. Many of you want to help your loved ones speak better, and so we're offering help for you. We're offering an independent study course that you can take. That's at teachingoftalking.com. We hope that you'll share this. We hope that you'll like this. We also offer a small group meetings where I will meet with you 3 times, and then I'll meet with you another 6 times in a small group, and we'll try that to help get you all started on your road to better speaking. So now we get no answer there. I'm going to try one more. I'm going to try somebody I know I'm going to try Joe. Everybody loves Joe. Let's see if Joe comes on. And I'm sure Joe is. I worked with him for a year. There's my friend Joe.
Yeah.
Joe had a severe apraxia. He still has a little apraxia, and he still has a little aphasia, but he can talk pretty darn good. And we started when he could hardly talk at all, and hardly anybody could understand him. And today he's doing beautifully, aren't you, Joe?
Yeah. One thing that I know, it got to be fun. And easy.
Yeah, that's my byline. It's got to be fun and easy. Now, Joe, and everybody ought to listen to this, because no truer words were ever spoken than what Joe Bourne is saying right now. It's got to be fun and easy. There's so many therapists, unfortunately, who make it hard, who make it difficult, who make it not fun.
Yeah.
So how do you what kind of speech therapy is speech therapy if it's fun? What do you do if it's fun? You mean speech therapy can be fun, Joe?
Yeah. I have gone to speech therapy 5 times.
Yeah. 5 different therapists?
Yeah. Only 2 of them were fun.
Only 2 of them were fun. Oh my goodness. So what was it like doing therapy that was not fun?
I hated to go do therapy.
So if it wasn't fun, you hated to go to therapy. You know, here's something that everybody needs to know. That, a lot of times families, if their loved ones don't want to go to therapy, families think that, oh, that's just because they're a little bit brain damaged. They don't know. Unfortunately, they do know. And if you have a loved one who doesn't like going, and I think I told everybody the story about the guy in California who his wife would take him to therapy and he'd refuse. he refused to get out of the car. Okay, Joe, anything else you got to share? Any other point you want to share with our friends?
No.
Okay. Well, thank you for that. That was one of the most important things. That was one of the smartest things I've ever heard you say. You know that?
Fun.
Fun. That's right. Okay, Joe. I'll see you around, okay?
Yeah.
Okay. Thank you.
Bye.
Isn't he great? Most people who speak like I do. They speak quickly. And that's the way Joe always spoke. But he had an apraxia, so we had to slow his speech down so that it was like this. Like this. And many of you saw John and Joan, who came on, same thing. Speech has to be very, very slow. There has to be a little pause between each word. Very, very important. Okay, I'm going to invite somebody else on the call. He's great. I just love Joe Bourne. And we had such a good time in therapy. He would bake cakes and he'd bake or cook something, and he'd always bring something to the rehab hospital, to the outpatient clinic. And guys, everybody loved Joe because he always brought food with him when he came. Okay, here we go. Let's see who else we have. Okay. So, guest request. Let's see Helen. I've had a chance to speak to Helen a few times. Gosh, what a wonderful person she is. I think Helen's Australia. I think she's from Australia. Isn't this? Hey, Helen.
Hello.
How
are you?
How are you?
Good, good.
What can you share with us this morning?
When my husband had his stroke, he had a swallowing difficulty to start with. No, I knew he had it, but no one really explained the mechanism behind it. So tonight was very interesting. Now that he's home, he eats what everybody else eats and he seems fine. There is a bit of coughing, but there used to be coughing before, so it's hard to tell. But I'll be a little more vigilant now, and I'll be a little more careful.
Okay, well, here's the thing you want to know, okay? You want to either make a written note or a mental note every time you hear him cough, especially if it's during eating.
Okay.
Okay?
Yeah.
So I would want to know if the coughing or the throat clearing occurs more on liquids or solid foods.
Right.
Okay? And are there any types of foods that he has a tendency to cough more on?
Okay.
All right? Will you make a note of that?
I will make a note of that.
Okay. Are you enjoying the classes?
Oh, I am.
And why are you enjoying the classes?
Because it's giving me a lot more information so that I feel that I can go forward and help him a lot more.
Then all this is worth it.
Oh, it is. But may I say, when he was up in the garden the other day and I didn't know how I was going to help to get him back down again, all he was saying was, it'll be right. But that's the Australian way, isn't it? It'll be right, mate.
How are you doing with your speech stimulation?
His easy road is over now. If he wants something, he has to ask for it.
Okay.
And his understanding, he knows when he has to start to work a little bit, and I think it's going to be really good.
Okay. And how do you help him say something? What exactly do you do?
First of all, I'll say, do you want lunch or breakfast or whatever it is? And he'll say, oh, yes, please. And I will say, can you tell me? And I'll start to mouth I. And quite often he can say the I want, and then we work on the other word. And sometimes I have to help a little bit more, but by the end of it, he's saying it all.
Good.
Breakfast is a difficult word, but Aussies often just say brekkie. So
Use
I'm happy
brekkie
to
then. Use
settle for that.
brekkie. Use
Yeah, I'm
brekkie.
happy for that.
Okay, then here's an idea for you. Once he does that, ask him if it's okay for him to say it 3 times. But ask him his
He's
permission.
fine with that.
Okay?
Yeah, no, he's fine with that one. I've asked and I've told him, and no, it's fine
Okay.
because
Sometimes
he's
what was that? I'm sorry.
he's keen to improve.
Okay, great. Well, hopefully I'll see you someday in Australia.
I hope so. I hope so. We've got a spare room. That'd be wonderful.
Okay, Helen, great. Thank you.
Okay,
Bye-bye
thank you.
now.
Bye-bye.
Great, 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 great. Kellyanne, Sheila. Hi, Sheila. Man, I sure would like to speak to Sheila. Hi, Francis. And Helen Maxwell just spoke with us. Let's see if there's anybody else who'd like to be on the call. How about Dorothy Marie Bryan? Let's see if she's around. Gosh, what an interesting person Dorothy Marie Bryan is. Let's bring her on. Gosh, this is great. Yeah, we're going to be on the road today. On the road again. Can't wait to get on the road again. And then tomorrow's class, who knows where we'll be, but you'll be with us on our ride down the highway. So, greetings.
I want to watch.
I'm not doing that
No, no,
again.
no. I want to. Okay.
So,
No. Okay.
Dorothy, how are you?
So.
So. Uh-oh.
Coffee. Oh no. Coffee. Right here.
Oh, you have your coffee? Good.
Yeah. Yes. Okay. Yes.
Okay. So, what's happening with you?
Okay. What?
Can we keep the camera still? Is that possible?
What? Yes.
Oh, the teaching of talking.
All
Oh,
right.
my goodness gracious. So, how's your speech coming along?
Well. Yeah.
Okay.
Slow though. Slow.
It's slow though. Yeah. You know, one thing that that every single person I've ever worked with on their speech is that it's never, never, never fast enough. It's never fast enough. The recovery.
I know.
But
I know.
But people recover. Okay.
I
People
know.
do.
I know.
Okay, good. So, how many words, when you speak to people, how many words do you usually speak in? About?
Varies. Varies.
From what to what?
Oh, I don't know. I don't know.
Okay. Can you tell me where you live?
Gainesville.
Gainesville.
Yeah, Florida.
Okay. And how many years have you lived there?
Oh, move around a lot.
Okay. So,
Okay.
all right. So one of the things I would do with your speech, I would slow it down like this. Because sometimes when you go to
Yes.
say a whole phrase,
Yes.
you have a little bit of an apraxia. And so what
Oh,
happens?
yes, I know.
So what happens is when you try to speak at a normal speed, the
Yes,
tongue can't keep up.
I know.
It's trying to keep up, but it can't do it. It just can't do it. Okay? So one thing is one word at a time.
Okay. Yes.
Now tell me something else and speak one word at a time.
Dogs rock.
Dogs rock.
I love dogs.
Wonderful. Now tell me something else.
Okay. Okay. Um, Lord, okay. I love birds. Birds.
Good.
Birds. I love birds.
Wonderful. Now, when you speak like that, everything, all the motor's working really good in there.
Okay.
But it only works really good when you speak like that. If you go much faster than that, guess what? It's like you wipe out.
I know. I know.
Okay?
What?
So, the thing you want to remember, oh my goodness, there's a kitty. Okay, so it's been nice visiting with you this morning.
Yes, and you too.
And remember to keep those words separated. Remember, Joe, he sounded really clear, but if he goes much faster than that, it's difficult to understand him. So I would work with two things with you. The two goals I would work with you on would be to separate each word when you speak, and the second would be to increase the number of words you say when you say something. Those would be the two goals I would work on with you.
Okay.
A pleasure.
I love you.
I love you too. Bye.
Right.
Bye now. Okay, great. Wonderful. All right, now I think we have maybe time for one more. Wasn't she great? Okay. There's so many things that can be done to help people speak better. So many things. Oh, Alejandro. I want to speak to Alejandro. Let's see if Alejandro will come back on. Wow. Alejandro. He lives like over in Holland. And can you believe that? That we can talk to people all the way in Holland. That's amazing. Wait a minute. Where'd Alejandro go? What happened to him? Let me check to see if we can do it again. I'm gonna add. Oh, he disappeared again. Wait a minute. Where is he? Where is he? Let's see. Guest requests. Okay, here it is. Here. Okay. Now it's trying to add him. This is so great. And I see so many wonderful people on the call. So many wonderful people. There's Bernadine. Okay, Bernadine, I'm going to get to you because you know you're special. You're special, Bernadine. We spoke at the very, very start of this, and you wanted to find out how to get on Facebook Live, and it's great to see you. Let's see if Alejandro will visit, and then we'll visit with Bernadine. Bernadine has a daughter who's got aphasia, and Bernadine is learning how to help her daughter talk. I mean, who else would be the perfect person other than a wife or a... Oh, there's Alejandro.
Hi.
How are you?
How are you?
Excellent.
Fine.
Good.
My wife,
Hi.
Miriam.
Hi there.
Hi, Mark. Hi. How are you?
I'm great. How are you?
We're fine.
Yes, it's
Thank you.
Okay, so we want to do something on this call. I don't know what it's going to be yet, but what
You're
should we do
going-
on this call today?
so,
What should we do on this call today?
and the call and what?
What
Yes.
should we do?
What should we do? I don't know. I don't know.
Okay. Okay. Well, I'll just lead the way then. Okay.
That's perfect. Yes.
All right.
Yeah.
Now, I
Yeah.
want to hear your wife's name again.
I'm Miriam.
Miriam. Okay, I've got it
Yes.
clearly now. And Alejandro, how
Yeah.
long have you been married to Miriam?
Oh, wow. 27
27.
years.
Okay. Okay, now, Miriam, I want you to give Alejandro a little more time to answer the question before you cue him.
Okay, fine.
Okay? Just give him a little bit more time. Because,
Yes,
you know,
I will.
for us, answering a question like that, we could answer it in a second. But with someone
Yeah.
who's got aphasia, it may take them a little bit.
Sure.
So,
Yeah, okay.
So Alejandro, I got another question for you, okay?
Yeah.
So how many years is it? How many years have you
Again.
been married?
20, 1, 2, 3, 4, 5, 6, 7. Oh shit. 7, no. 1, no. 1. I don't know.
Okay, now,
Sorry.
now, Miriam,
Yes.
what I want you to do is I want you to go 27 years.
27 years. Yeah.
Okay, so when he gets stuck, I want you to put it in a question. All right?
Okay.
Okay, so
Yes.
so Alejandro, where did you meet her?
Oh, the train. The Miriam meet Miriam and I meet the train.
Wow.
Yeah.
Miriam and I meet on the train. That was very, very good. Wow, that was just super. That was super. So when you met her, was she sitting next to you or behind you or across from you?
Yeah, behind me. Yeah,
Oh.
yeah, I know.
So who made the first move? Did you make the
My
See, this is what speech therapy is about. It's about talking. It's not about looking at stupid flashcards.
Yes.
Okay?
yeah.
It's about
Yeah.
That's true.
talking.
Yeah. Yeah.
So who made the first move?
Myself.
Oh. You did. Is
yeah.
that right? Can you say
Yes,
Can you say I did?
I did.
Okay.
I did.
Okay. So did you go sit down next to her?
No. I got no. I got not to the go. Went to the train door. Oh shit! The words.
So you
Please.
went to
I got the off the train
yeah.
and maybe Oh,
So you got off the train.
yeah.
Okay.
And the walking, walking, m-
Good. Yeah.
what, I'm walking, and the same person, Miriam,
Ah.
and okay, I say, oh,
What'd you say
sorry.
to her? What'd you say to her?
Well,
What'd you say to her? I'm dying to find out.
I say to her, I please, no, I, 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 mm,
Okay, time out 1 second. Time out 1 second. Miriam,
Yes,
what did he say to you?
he said, hello, can I invite you for a coffee? That is what he said.
Oh, wow.
Yes,
So
he
now,
did.
that's two different statements. First,
Yeah.
you said hello, and then you
Mm-hmm.
said you want to come for a coffee, right? Okay. So now I
Yes.
want you to put those in a question back to him,
Yes.
like
Okay.
this. Did you say hello?
Yes. Okay.
Go ahead.
Did you say hello?
yes, yeah. Hello, but
And
and the
did you?
make, sorry,
Did you ask me to drink a coffee with you?
so again,
Did you ask me?
I know you.
Did
So
you?
what you would do here, Miriam,
Sorry,
is you
sorry,
think of a
Yes.
three-word
tired.
phrase. So
Yes.
so it would be like this. Watch, Alejandro.
Yeah,
Did you say to her, "Let's have coffee"?
Okay.
let's have a coffee.
Oh, that's what you said to her,
Yeah,
or something like that, right?
yeah, yeah. It's okay, fine.
So what did she say?
Yes,
She
yeah.
did.
Yes.
Oh man, what a lucky guy you were. Hey, I got one more question for you. Okay?
Yeah,
Was it love at first sight?
yeah.
Really?
1 week
Yeah.
married.
You're kidding me. 1 week and the two of you were married?
Yeah.
Wow. Okay, so this is how this wonderful. You're a lucky guy, and Miriam, you're a lucky guy. You're a lucky
Very
woman.
lucky.
Wow.
Very lucky.
Okay, so this is what the therapy is like. It's talking.
Yeah, we understood that. Yeah.
Yeah. And Miriam, you can get really, really, really good at this.
Yes.
My wife is my wife is a nurse.
Ah. Wonderful.
Well, that doesn't matter, but what I understand from you is that to help Alejandro sometimes is to put simple question, no? If he gets stuck.
Yes, with the answer in the
Which-
question.
Yes.
Okay.
Yeah, I get it.
Now
I get it.
but you have to make sure that you know the number of words to use.
Yeah.
And then
Yeah.
there are questions, and then there's the grammar, and then there's a bunch of other things. But
Mhm.
this is a start. This is kind of what the teaching of talking method is about.
Yay!
It's about finding out all kinds of neat stuff about people. Oh man, could we talk? We could talk about Miriam, couldn't we?
You must know a lot of stories too.
I sure do. Okay, you two. Well, it's been great speaking, and hope to see you on
Thank
the
you.
call.
Thank you.
Okay.
Thank you.
Bye-bye now.
Bye.
Bye.
Have a nice day. Bye bye.
Bye.
Okay, one more, and then we got to call it. Then we got to call it a day. Isn't this great? Isn't this terrific? This is why speech therapy is so much fun. This is why speech therapy is so much fun. It's not about flashcards. It's not about iPads. iPads are okay to keep you busy, but they're not good to teach you how to talk. I saw somebody online the other day who said, "Oh, our speech therapy is done. My husband still can't talk. I just bought him an iPad and an app." Gosh. Unfortunate. Okay, so here we go. I want to see this last person, and this is, okay, I'm getting there. Okay. Ooh. Let's see, how do I do this? It's this way. Okay, I'm getting there. Last person for the call today. And here she is. Let's see. Right, friends to watch. No, we don't want the friends to watch. We want this one. Bernadine. Okay, Bernadine. Okay, isn't this wonderful? This. Okay, Bernadine. Where are you, Bernadine? I hope you sure do come on here. Gosh, we've had a good time today. We've talked about swallowing problems. We've talked about speaking and about motor speech. It says this guest declined. No, she didn't decline. You're crazy. Let's try it one more time. I'm going to try to approve her again. So we're going to try to add her again because I know she wanted to be on the call. I saw her in that outfit, and I can tell. So it says the guest declined to live. Okay. Let's see if there's one more. Let's see if there's one more. It says there's an X by approving. I don't know why that is. Let's see if there's anybody else real quick. Let's try one more. How about if we let's invite Brandy Lynn Williams. I don't think I've ever met her. And then after that, we're going to call it. So, yeah, this is our last week of the Facebook Live, and we're gonna create something else for Facebook Live too, for people who are learning more about speech difficulties and about how empowered they can be when they can learn about speaking difficulties, and where we have Savannah, Georgia. We have
Hi,
hi there. And what is your name again?
Brandy.
Hi, Brandy. How are you?
I'm doing well. Thanks for asking. How about you?
Oh, I'm in my element.
In
My
your
car.
car.
So talk to me. What's happening? How come you're on the call?
Well, I'm just learning. I'm a new grad, so I start my job in about a week. So yeah, so I'm just learning, and I love how you put it in a way that is simple, so people can understand. Because a lot of times we use language that's not so simple. So, and I want to share my story. I had a stroke back when I was 20.
Wow.
So it's been 7 years. And that's what really inspired me to become a speech language pathologist. And I had apraxia, I still do, but it's more on longer syllables, 5 and 6 syllable words. And I have aphasia. It's mild now, but some words I'll just lose in thought. And I had a swallowing disorder whenever I had the stroke. So to be able to relate to my patients is what's, I think, gonna make me a great speech pathologist. So I just love learning through this course how to explain to my patients in a much simpler way.
Great. Okay, I'm gonna I want to tell you a story, and then I'm gonna finish this up. Okay?
Okay.
Because this story applies to you, and it applies to everybody out there. I was working with a gentleman at Tier Memorial Hermann Outpatient Clinic, and I was trained to use the word disorder for speech difficulties. And you know, when I think of the word disorder, I think of a bathroom that says out of order. I don't know if any of you have ever had to go to a bathroom, and you go into the 7-Eleven or the store or whatever it is, and there's a sign on the door and it says out of order. Okay? And you know, the word disorder to me has a very negative connotation. So one day I was working with a patient and his wife, and I said, you know, your husband has a pretty serious speech disorder. And she looked at me and she said, Mark, she said, my husband is not disordered. And she said, I don't like it when you use that term. I don't like it when you use the word disorder to describe my husband. So that day, I made a vow. And the vow was that I was never going to use that horrible word again. That any time that I worked with a person who had a speaking difficulty or a swallowing difficulty, that's the term I used. Because it's not condescending. It's not diminishing. It's not a negative word, which I think disorder is. And I think a lot of people, maybe subconsciously, when they think of the word disorder, think about a bathroom with a sign on it that says out of order. Because the word is order is inside. So anyway, that's just my 2 cents. And this has really been great, Brandy. Thank you for coming. And I hope you'll join us for our other visits this week. And if there's any way that I can help you whatsoever, but you need to learn teaching of talking. You learn that and you'll be 40 years ahead of everybody else out there.
Right.
Okay.
I will be working with the geriatric population. It's a nursing home setting. So a lot of my patients, I think, will benefit from teaching of talking.
Good. Great. Okay. So on that, I'd like to thank everybody for being on the call. It's been a wonderful experience for me, and I hope it's been that way for you. We'll see you tomorrow. Tomorrow night, we meet at 6 p.m. Eastern Daylight Time. I don't know where we're going to be, but you won't see me in the car. Wait a minute. Bernadine wants to be in the video. Should we? Maybe we should try to see if she'll come on now. Because I know she wanted to speak with us. It has a little X in a box next to you, Bernadine. it has an X with a square. So I'm going to try just one more time. And I've never seen that box with a square with an X in it. So I don't know if maybe you don't have enough bandwidth, or if maybe your camera's not turned on, or I'm not sure exactly what it is, but we'll give you about another 10 or 15 seconds, because I know that there's a reason why you want to be on this call today. And no, there's I don't know, there's something with your phone, or the bandwidth, or the way you're holding it, or I don't know, but you want to find that out so that we can talk tomorrow, or we can talk Wednesday. Okay, Bernadine? I'll put you first on next time, or whenever you're on the call next. So please, everybody, please share this video. If you are on a number of pages, or you're on some aphasia pages, please share this. Please share it. Some of the descriptions that I've used are very, very easy and very, very simple. And it helps people understand. And that's what we want to do. We want to help as many people understand as possible. So please share, please like, and please, next time when you're on the call, bring somebody with you. Invite somebody to come on the call so that we can share with them also. And just remember that during this month, we have a special promotion on, if you want to take the Teaching of Talking online video course, go to teachingoftalking.com. That's an independent study course that you can take. I'm also taking a few people who'd like to get more in-depth into the teaching of talking. And I have a program where I work with you individually, with your caregiver or your loved one, or you by yourself. And I work with you a couple times individually, and then we have some small group calls. So check that out at teachingoftalking.com. On that, I love you all, and I love you for giving me the challenge to be here and to help you, and we'll see you tomorrow. Bye-bye now.